YouTube channel. There we go. And it'll also be on the center's link. It'll be all kinds of different things that wherever you have. And if you registered through the center or Eisenhower, we'll also send you out the live link once it is edited and ready for viewing. But no further introduction needed. But with this in mind, it's a great topic and one that is close to my heart and many friends and family that have gone through this. And so I'm looking forward to having Willy tell us more about everything going on. With that, Willy, it's all yours.
All right. Hello, everyone. Thank you for joining me today on our discussion on men's pelvic health. I'm a physical therapist at Eisenhower Health, and I thank the center for having me. So, a little bit about me. I'm a doctor of physical therapy, and I specialize in pelvic floor therapy. I'm from Los Angeles, and I've had the pleasure of being able to treat the queer community. And I really enjoy treating in men's health as well. So, in the pelvic floor world, men are an underserved community. So, it's estimated that they're about 20 years behind women's health. So, I'm really passionate about advocating for men's health and as well as for queer pelvic health as well, because also that is underserved and there's a big need for that. Men specifically do face specific hardships in seeking and obtaining pelvic health. Men in general have a shorter life expectancy, increased suicide risk, unfortunately. They often wait too long to get treatments. And a study conducted in 2015 showed that of the top 50 urology hospitals, only 32 of them offered men's pelvic health program versus 98% offering a women's pelvic health program. So there's a huge divide there in regards to men's pelvic health. So I'm glad you're joining me today and hope you learn a thing or two. Okay, so let's talk about common conditions of the pelvic floor that men may face. So starting with urinary incontinence, that is the unexpected leakage of urine, and that affects about 11% of men. This is less common than in women because women do have a shorter urethral tract. That makes it a little easier for urine to escape. Now, these are all estimated values, so just keep that in mind. Men tend to underreport their symptoms, so these numbers very well may be much higher. Next up, we have bowel incontinence. So that's when you unintentionally lose stool, and that affects about 7% of men. Nocturia is nighttime urination, so getting up out of bed to go pee, and that's affecting about 21% of men, and that increases with age. Now, rectal prolapse is when your rectum slips out of its own canal. It's relatively rare in men, but still something that can happen. And pelvic pain, about 15% of men experience that. And it is pretty common in the younger population. So I will see, people of all ages for pelvic floor dysfunction, but pelvic pain is pretty common in younger folks as well. And the biggie, erectile dysfunction, there's a huge range, 3 to 76%, and it does increase with age, and that could be difficult.
Okay, it looks like we lost Willy.
Oh, hold on.
Yeah.
We're having a tech issue on our side here. Hold on one second.
Yeah. I could do a little soft shoe maybe. Maybe I could sing. I'm tone deaf. So there will be no intermission music happening for sure. He's still connected, so I'm wondering what happened there. Because you're showing him still on, right, Becky?
No, he fully disconnected. That's Brett.
Oh.
Brett's is still on, yeah, but
I've got Brett up top, but I still have Willy showing.
really,
Yeah, with camera off. Well, hopefully they'll get it figured out.
yeah.
Sorry, folks, for this inconvenience. Doesn't happen often on these Zooms, that's for sure, but every now and then.
So I just wanted to say hello to everybody. Hi,
Oh,
Candace.
David, I said hi earlier, but your camera wasn't on,
Oh.
and there's another David on too, so. Hi, how are you doing?
All right, gang. Sorry for the delay. We just had a power outage on one of the walls. Go figure.
Oh,
hi.
So
Oh,
while I'm
good to
shifting
see
it to
you,
another, I'm
David.
going to put Willy on this headset.
Yeah, I've been
And
doing my stand-up comedy act while
Yeah,
I'm
right.
doing that, so
So
it's
do me a
all
favor,
good. The
turn off
audience is feeling good and they're laughing. All kinds of things happening here.
You just move your slides.
Well, it's good to see you looking so good, David.
yes, agreed. Hi, David.
All right. So now you're
All right, back to it. Oh, where'd you go?
I think he's grabbing some.
Oh, probably his big samples that he had.
Yeah.
All right.
And then
Can everyone
Willy
hear
just
me?
Willy just make sure the mic part of your headphone is closer to your mouth.
Okay, is this
There
better?
you go. Perfect.
Okay,
Thank you.
Yep.
Okay.
Okay, so moving on along. Sorry about that. Okay, so what kind of things do we treat as pelvic floor physical therapists? We treat urinary frequency, so that's going to the restroom too often, usually less than every 2 hours or more than 8 times during the day, and urinary hesitancy, which is difficulty starting the stream of urine. We also treat constipation quite frequently. A long time in between passing stools, a lot of straining related to constipation. We also treat hemorrhoids, anal fissures, which can be very stubborn to treat, and not a lot of people know that you can get physical therapy for those. And incontinence is a huge thing that we treat, both urinary or bladder, and fecal or bowel incontinence. And we'll talk more about that in a later slide. Nocturia, that's frequent urination at night. Again, erectile prolapse is when your rectum is kind of falling out of its cavity, as well as we treat pelvic pain, both general pain that stems from the pelvic floor or pelvic pain that is more localized in the pelvic floor. We also treat sexual dysfunctions, erectile dysfunction, and ejaculatory dysfunctions. Okay, here you can see a diagram of the pelvic floor muscles on the right. You can see that these muscles are at the base of your pelvis. They start at the front of your pubic bone. They wrap around to your tailbone. And you can see that the muscles attach to the base of the penis itself. And so has very strong functions in urinary control and sexual function, as well as the rectal control. In this view, you can see more of the organs in relationship to the pelvic floor muscles, which lie below. You can see the bladder, right under that. You can see the prostate, the urethral tube that exits through the penis, and the rectum in the back. All right, what are the functions of the pelvic floor? They help to support your organs. So your organs have to sit on top of these muscles. They're kind of like a trampoline. And so you need to have adequate muscle strength and control to keep those organs in place and to prevent leakage of the front or the back. And so, yep, controlling urination and bowel movements, sexual function, as we mentioned. And it also works with the core or your abdominals to better provide you postural support in general. Okay, so what are bladder irritants? Bladder irritants are ingredients that, when consumed, can cause the bladder to, it makes you want to pee basically, but can lead to symptoms of urinary urgency, frequency, can lead to more incontinent type symptoms. And the biggest offenders for irritating the bladder are often caffeinated beverages, alcoholic beverages, and acidic foods and beverages. But there's also soda or carbonated beverages, which are acidic because of the carbonic acid within them, creating the bubbles. Chocolate can be irritating, dairy, as well as spicy foods. So if you notice you consume any of these and you feel like you have to pee, or you might even have pain or discomfort in that region, it might be that you're consuming too many bladder irritants. All right, water intake is another huge topic of importance. Typically for an adult male, they recommend 64 to 125 ounces of water per day. For younger men or the older population, you can just take your weight in pounds and then divide it in half, turn it into ounces. So if you weigh 200 pounds, you would half that, so 100, and then turn that to ounces. So you would need about 100 ounces per day. But a good way to eyeball it is check your urine color. Typically a pale yellow color means you're adequately hydrated. So water is important. It helps dilute bladder irritants. The more concentrated your urine is, the more it'll irritate the lining coming out. It's also important for normal bladder and bowel function. You need enough hydration for your stool as well when it's coming out. And you need water for most of your body functions. So try to get that in if you can. That's a common thing I see is people underdrink. Okay, so types of urinary incontinence. So we have stress incontinence, which is also exertional incontinence. So when you're coughing, laughing, sneezing, or doing some strenuous activities, you might notice leakage of urine. Again, it's more common in cisgender women, but men can have that too, especially if they've had history of a prostate procedure, including a prostatectomy for prostate cancer. So that oftentimes will have men experience some form of loss of urine. But it's very treatable, and we can treat patients before, during, or after their cancer treatments for the best results. Next up, we have urgency or urge incontinence, which is where you feel the sudden onset of the feeling that you have to go and you can't quite make it in time to the restroom. So you lose the urine. Mixed incontinence is when you experience both stress and urge incontinence. And that can be a little trickier to treat because we're trying to work with these two different factors, but quite common and very treatable. And so overflow incontinence is when you're not emptying your bladder all the way. And so what happens is you're going more frequently and you tend to lose urine as the bladder fills up. Okay, nocturia. So this is excessive urination at night. It is common as you age. After the age of 60, it's common to urinate 1 time per night. However, at 2 times or more per night, it doubles your fall risk due to your daytime sleepiness. So it does interrupt your quality of sleep. So it's important to try to regulate and keep things down, try to decrease the amount of fluids you're drinking in before bedtime. Some medications can affect your urine output at night, such as blood pressure medication. So just something to keep in mind. So what can we do for incontinence and nocturia? One of the tools that we employ as physical therapists is biofeedback. And this is an image on the left-hand side depicting our office, one of our rooms. And what biofeedback is essentially we apply sticker electrodes to the skin or the outside of your pelvic floor, and they read the electrical activities within your muscles, which is really helpful because these muscles are inside, they're internal, you can't really see them. So this way we can give immediate feedback to the patients and they can see when they are contracting their pelvic floor muscles. They can see the bar graph on the monitor there rise. And as they relax, we can see it fall. So that's a real good technique, training technique for patients. We also use manual therapy. So we can do joint mobilizations around the pelvis, spine, which is just creating a little bit more movement within your joints, or soft tissue work, either on the muscles of the pelvic floor or around the pelvis or back. We can also employ strengthening, so Kegel type contractions, if you've ever heard of them. That's when you kind of feel like you're squeezing your sphincters and feeling the muscles lift up. A lot of people know Kegels as when you're urinating to try to stop that stream midstream. So those muscles are involved if you've heard of them. And I want to put a disclaimer that, not all pelvic floor therapy is about Kegels or pelvic floor contractions. Oftentimes, for certain conditions, we want to promote stretching and relaxation of the muscles. So, it's not just Kegels. And so education is a huge part of our treatment. We aim to get to do activity and consumption modifications to better promote better pelvic health. And we'll talk a little bit more about how we do that. All right, so constipation and rectal prolapse. So depicted here, you can see a photo of a prolapse all the way on the right-hand side, where the rectum is coming outside of its own canal. And it can be related to constipation, more so straining while on the toilet. Constipation itself, we treat with a mix of dietary suggestions. We retrain the muscles to decrease pushing or straining to be able to have a bowel movement. Dysynergetic dysfunction or dysynergic defecation is a specific condition where the muscles of the pelvic floor are contracting instead of relaxing when you want to have a bowel movement. So that kind of gets in the way of the natural reflex of how you want to empty your bladder, your bowel. In terms of The rectal prolapse, we want to ensure that you're not straining when you have a bowel movement, and also we want to strengthen the muscles to better reinforce the walls of the rectum so that the tissues are not falling out. All right, so let's talk about a healthy bowel diet. Water is really crucial because, again, it hydrates the stool. Fiber is important. Most of us are lacking in our fiber intake. Um, so you want to read your nutrition labels carefully to see if they provide fiber, what type of fiber, and how much fiber. So without getting too much into it, soluble fiber can be helpful for more diarrhea type symptoms or looser stools. And insoluble fibers can help rehydrate your stools. So if you are constipated, incorporating more of that into your diet can be helpful. If you're not getting enough fiber in through your regular diet, you can consider taking fiber supplements. Make sure you're drinking plenty of water with them. And you want to increase that intake slowly, whether it's with natural foods or with supplements, because you don't want to get an upset stomach. You know, the body takes a while to get adjusted to processing all of that fiber. So we typically recommend 14 grams of fiber per 1,000 calories. So if you have a typical $2,000, 2,000 calorie diet, you want 28 grams of fiber a day. You can also Google fiber foods if you want more examples of what you can add to your diet. Okay, so what is a healthy way to have a bowel movement? Again, you want that healthy diet, incorporating fiber and enough water. 150 minutes of moderate exercise a week can help promote motility, increase circulation, help things kind of pass through the intestinal tract better. You want to coordinate with your pelvic floor muscles and your abdominal muscles to avoid straining and to best relax and allow yourself to pass the bowel movement. The relaxation process can include many things. You can try, I tell patients to moo to poo. There's actually a good YouTube video on that. So essentially you're mooing on the toilet. Low tones have been associated with relaxation of the pelvic floor muscles, and higher pitched tones excite or have the muscles want to contract. So I really like the mooing. It helps patients, one, breathe, because a lot of people hold their breath while on the toilet, and two, it promotes the relaxation. So positioning's important as well. You can use a footstool on the toilet. We'll talk a little bit more about how that helps. But that's a recommendation I give out a lot. You want to avoid straining and avoid distractory things on the toilet, magazines, scrolling on your phone. You don't want to sit on the toilet for a prolonged period of time. I give patients about 10 to 15 minutes. If you aren't having any movement occur without straining, then just get up, do something else until you feel that calling. And I recommend using a bidet just for hygienic reasons, but also it can be helpful if you are experiencing irritation around the skin, if you are one who really scrubs with the toilet paper, you might want to invest in a bidet. Okay, so the anal rectal angle. So here on the right side, you can see a person kind of normally sitting on the toilet, and there's a sharper angle for the stool to have to pass through. versus all the way on the right. When you're squatting, your knees are higher than where your hips are, and that angle kind of straightens out, which makes the stool easier to pass down with gravity and with less straining needed. So um, if you don't have a squatty potty or footstool, you can always go on your tippy toes, kind of lean forward with your trunk to get that kind of same position of an increased flexion angle of your hip. All right, bowel movements. So here at the bottom, you can see a depiction of different types of stools, the Bristol stool scale, um, from type 1, where it's kind of hard pellets, all the way to type 7, which is watery stool, diarrhea, basically. And we want to aim for a type 3 to 5, where it's well formed, not too dry, not too wet, and bowel movements should be easy to pass and not require a lot of wiping. So that's how you know you're having a good bowel movement. Um, and the normal ranges of bowel movements are you can go twice a day or 3 times a week. Those are within normal limits. Constipation is when you have less than 3 bowel movements a week, and diarrhea is having loose watery stools occurring 3 or more times per day. All right, so pelvic pain. Pelvic pain can be felt not only in the pelvic region, but also in the low back, lower stomach, hips. But typically, we'll see patients having pain in the penis, typically at the tip of the penis, the testicles, the scrotum, or the skin of the testicles, the perineum, the anal or rectal regions, the inner thighs, things like that. And so the interplay between the muscles, nerves, and the bones, as well as ligaments, can affect patients with pelvic pain. So another view of the pelvic floor muscles, we have to take into consideration the relationship between the bones, muscle, ligaments, but also the low back, pelvis, and hips can contribute to the pain. So with pelvic floor therapy, we will usually screen for not just the pelvic region, but neighboring sites that may be involved. So what can we do for pelvic pain? Similar to the other slide, we do a lot of education about how you can best approach your pelvic pain, utilize lifestyle, dietary habits that would better promote pelvic health. Biofeedback can help reduce tension. Many times, pelvic pain patients have an overactive pelvic floor. And so we need to learn to unwind, stretch the muscles, reduce the tension that may be causing your pain. Again, we'll do possible manual therapy, so mobilizing the joints or the tissues to promote better mobility. We'll prescribe a therapeutic exercise program for you to do at home, and you're going to be doing exercises in the clinic as well to best target functional activities so that you can be pain-free again. And erectile dysfunction. Okay, so pelvic floor therapy can help with erectile dysfunction, but it's important to keep in mind that for a successful erection to occur, you need to have, there's a psychological component to it, emotional, hormonal, cardiovascular. So you need all of those domains to be pretty good to have a quality erection. One of those things is having sufficient pelvic floor muscle strength and control. So that's how we can help you. The other things you need to see other specialists for. But, for things like lower testosterone, in case you need medications, if you have poor circulation in general. So that's just one domain in which we can help with erectile dysfunction. And so how does the pelvic floor muscle assist with erections? So you need to be able to relax the pelvic floor muscles efficiently for blood flow to enter the chambers of the penis. And you also need to be able to have the muscles contract and clamp down at the base of the penis to prevent the flow of blood out of the penis. So that's the maintaining the erection part. And so if your pelvic floor muscles are too tight or too weak, you may experience difficulty getting an erection or maintaining an erection. So how can we help with that? We're going to use coordinated contractions and relaxation techniques. Again, biofeedback can help with that. We utilize mobilization to help release restricted tissue that may be impeding flow. Strengthening exercises, relaxation, education, and a home exercise program. So similar things. And what can you expect out of pelvic floor physical therapy? The first session will do an in-depth evaluation where we get a thorough intake of your history, your symptoms, all of that. And we do our tests and measures to get a good baseline. We can either do an internal exam, which for men would be a digital rectal exam, so with a gloved and lubricated finger into the anal canal, and we can feel for muscle strength, weakness, restricted tissues, tender points, spasms, things like that. Anything that can happen in normal muscles can happen in your pelvic floor muscles. And so that can better guide your treatment plan. And so education is a huge component. We do a lot of education in the evaluation, but also in your treatment, including your follow-up treatment. So education, again, we're trying to have you learn a little bit more about your body, about how to best control your body. For men, it's about empowering that region. A lot of men are kind of out of touch with that. So that's a huge component. And actual treatment usually occurs during the follow-up appointments where we'll do a combination. We can do internal work. We can do external work or assessments where we feel for the muscles outside, as well as just kind of see from the outside looking in, and assess how you're able to best use your muscles. But that's where we prescribe exercises, do manual therapy, things like that. So in conclusion, everyone has a pelvic floor. You know, cis women, cis men, trans feminine, trans masculine folks. And so that means that there's room for dysfunction to arise in everyone, but that also means that pelvic floor therapy can be beneficial for everyone. And so some of the benefits include improving bladder function and control, enhancing sexual function, reducing pain, having better bowel function, and improved athletic performance. So what can you do if you or someone you know might benefit from pelvic floor therapy? We do have a pelvic health program here at Eisenhower. We're in the Dolores Hope building on the Rancho Mirage campus. We do need a physician referral. You can get that from your primary care physician, a urologist, you know, anyone who can prescribe. and we accept most insurances. So if you want to save the phone number or look us up, you can call if you have questions. So now we're going to open the pelvic floor for questions, if anyone has any.
Yeah, Willie, thank you. We do have a question in the chat, and then we can open it up for live. Is there a recommended frequency for pelvic floor therapy visits? And when should a person commence with pelvic floor therapy prior to surgery as treatment for prostate cancer?
Okay, very good question. So the frequency in which you come in for your pelvic floor therapy appointments varies. There's a range. I'll typically see patients once a week, but if you do have a very severe case, I might do 2 to 3 times per week. If you have very mild symptoms, you could come in once a month even, but typically I do see patients once a week. And for the duration, that also depends. I usually do 8 to 10 visits initially, just because it takes a while for pelvic floor muscles, like any muscles, to respond. It's like going to the gym. You can't expect results right off the bat. And so with specifically for prostate cancer, I would recommend giving yourself at least 2 months, or at least a month before proceeding with treatments for pelvic floor therapy. At least get the evaluation in, because it's better to get you in knowing how to do the exercises properly or know what to do, and strengthen your muscles in preparation for whatever cancer treatments you're going to undergo. The stronger you are starting, the better your results will be post-surgically.
Here we go. There's the next one. What is done when mood or medication creates difficulties?
Our mood or medication for any pelvic floor dysfunctions or erectile dysfunction.
Maybe we could open the mic for that one. If you need more information from Peter.
No, I think the original was mood or medication. If you're on, I didn't get the whole chat kind of piece here, unfortunately, but I believe the question was like with any kind of mood altering medications that you may be on for psychotic issues or other things that are going on through a, say, therapist, unrelated to this. But then now you have a pelvic issue. How do you monitor that?
Sure. Whereas we work with the muscles and the physical component, the neuromuscular component to pelvic health, you may want to see, we work with a lot of sex therapists oftentimes, to get the psychological component of care as well, because it does come into play. But generally with those type of conditions, really focusing on relaxation work and just getting in tune with the muscles is really helpful. Again, we don't treat for that, but we do encourage working holistically with a lot of other practitioners to better encompass the whole breadth of pelvic health.
All right. I don't see any of the ones in the chat immediately, and Candace, unless you do, but let's go ahead and open it up feel free to unmute yourself and ask any questions of Willie, and or use the chat, whichever you prefer.
I just wanted to jump in here and say thank you to both Willie and to the center. I had a prostatectomy 4 weeks ago, and I'm planning on.
We'll give that a minute. Can you hear me over there?
Yes.
Yeah. Okay. I'm sorry, because I'm not currently co-host on the what I'm at right now, so I'm not seeing all the chat. If there's more things in the chat.
Okay, David's
Candace, are you
talking.
still there?
There's someone talking and asking a question. So, yeah, just mute yourself right now.
I'm not
Brett.
hearing.
Oh,
Can you hear
can't
me?
hear.
Can everybody hear me?
Okay, now I can, Candace. Sorry.
Okay, someone's asking a live question. So just go ahead and mute yourself, Brett, and go ahead,
Thank
David.
you. Yeah, we're having tech issues on my piece here. Sorry about the game.
Yeah, so go ahead, David. Go ahead with what you were saying.
I just wanted to thank the center and also Willy for this. I had a prostatectomy 4 weeks ago, and I'm planning on having PT at Eisenhower, probably with you, Willy, who knows. But this has been like such an amazing introduction to what physical therapy for this is, because frankly, I had no idea what it was. And I was going to do some research, and then I saw this and signed up for it, and it was exactly what I needed. So thank you very much.
Great.
Thank you for
You're
sharing
welcome.
that. Yeah. And
Becky,
we
if
look
you're
forward.
on, could you just take the screen down and just open it up so people can be more apt to ask questions? There we go. Okay. Okay, so now we see some smiley faces, at least. And there we go. It takes a second. So if anybody else has a question, you can go ahead and unmute yourself, and go ahead and ask. And David, I have to say you're looking great for just having that 3 weeks ago, and you were in all of our prayers. That everything went well for you, and I'm glad it did. So, any other questions? Nope, we've got a couple people drop off. Well, if there are no more questions, I just want to thank Willy. I'm not sure where Brett is, but I'm just going to thank you, Willy, and welcome to Palm Springs in the area. And,
Thank you.
Yeah. Oh, there you are, Brett. I'm kind of
We
closing
switched
it up.
names.
Yeah.
I'm now Willy.
I'm not Brett.
It's one of those
we do a lot
days.
of transfer over here.
It's
We're
one of those Freaky Friday days.
sorry for all the tech issues. The computer died, the wall socket died, and then and then Zoom wanted me to reboot with a whole new system, which was, it never goes easy. Sorry about that.
It's just one of those days.
It'll be a lot easier when you come see Willy and have a pelvic exam. That's the whole idea.
Yes.
So, Willy, do you only do male PT?
Oh, great question. So I do treat everyone. I treat women, men, transmasculine, transfeminine individuals. But, I do focus a lot on the men and the queer health because of the need. Yeah, and I love doing it. So.
And Willy, you practice here on campus in Rancho Mirage, not in Palm Springs or one of our other clinics. Is that correct?
Right. I'm at the Rancho Mirage campus in Dolores Hope.
Fantastic.
Okay, well, thank everybody for joining us today. We just gave you back 10 minutes of your life, so you don't have to thank us. We'll just, know that we'll take it out later.
Yeah.
Yeah, and as mentioned, you can start practicing your, your pelvic kind of things you need to do based on the presentation, and we'll also send this out to you in very short order to get it online and out to everyone.
Great.
Okay, thanks everyone.
Perfect.
Thank you very
Thank you.
much.
Nice to meet everyone.
Thank you.